I'm Dr. Camille Cash. I'm a board certified plastic surgeon. I graduated from medical school at Baylor College of Medicine, after which I did a 5-year general surgery residency, followed by a 2-year plastic surgery residency. I am board certified in both general surgery and plastic surgery. I have been in private practice for 18 years. My practice focuses on cosmetic surgery, and really I really like to combine the idea of surgery and artistry, surgical techniques for patients to achieve their results. My tagline is "You Only Better," because my philosophy is that I want to use plastic surgery or rejuvenation techniques to help restore patients' beauty. I want them to feel better about who they are and understand that each patient is an individual and there's not a cookie cutter approach. My goal is to provide patients options both surgically and non-surgically. So I like to use, for example, for facial rejuvenation, we start with skincare. We may do injectables with neurotoxins or fillers, and that may be a lead up to a surgical procedure like an eyelid lift or a facelift down the road. I like to use different technologies for minimally invasive procedures such as FaceTite that can help achieve facial rejuvenation without surgery, without the downtime, and without anesthesia. So for me, it's about assessing my patients and their individual needs, and then me tailoring an approach to really achieve the best outcomes for them, and to give them a variety of options on how to get there. One question that patients always want to ask is, how did you know you wanted to be a plastic surgeon? That is not something I woke up when I was 10 years old and said I want to be a plastic surgeon. It's an interesting story, so I'll walk you through it. My mother and I decided we were going to take a college tour, and our first stop was in Washington, D.C. at Howard University. My goal was I wanted to get a sweatshirt from every school that I visited, and so we were going to the bookstore. And I remember that we were crossing the street, 6th Street, and there was a lot of traffic, but there wasn't a stop sign or a stoplight. And I'm watching the car, and I watched the car hit my mother, who had already entered the crosswalk, and the car hit my mom. So I saw my mom get hit by a car in front of my eyes at age 16. Get in the car, ride with my mom a couple of blocks down to Howard Hospital. She was whisked away to a treatment room in the emergency room, and I'm left in the hallway by myself. And then I kind of looked over and I saw an open room, and in the room was a man who had clearly an injured hand, and his hand was on a Mayo stand, and I could just see fingers not in the right direction and blood. And at that point in time, I stopped thinking about my mother, and I looked at his hand, and I tried to look closer and get closer and tried to figure out what's wrong with his hand, what happened, what's the story, and then what are they going to do to fix it? And I found myself immersed in that person's injury. And then the back of my mind said, that's weird. You should not be thinking about mangled fingers. But there I was. And so that was my first inclination that I might want to be a doctor. Fortunately, Mom had a broken leg. She survived. I went on to tour colleges by myself and ultimately selected to attend Howard University. And so unfortunately, she sacrificed herself, but it helped me figure out my future career path.